Good morning, lovelies. I just wanted to give you an update. My procedure went very well yesterday, and I'm a little beat up today, and it's going to probably take a couple more days for recovery. As you can see, this is where they cut me. They cut me, and then they put a tube there so that they could put the port through that and bring it and connect it right before you get to the vein, right before you get to the heart. The port is right here. I'm not sure how many stitches I have, but I do know that it's layers of stitches. So they suture underneath the skin, and then they suture over the skin at the top, so that it's kind of neat. I'm in an enormous amount of pain. Moving my top part of my body is very, very painful. So here I am. I have the Metaport. It'll take a couple of days. They say at least 48 hours before I can start my IV medication, because they don't want the port to get infected. And so I just need to recover anyway, because I'm pretty beat down. So I'm going to probably spend the next couple days in bed resting. I'm going to be really light on social media or any kind of work. It's just not going to happen, because honestly, while I have the spirit to work, I'm just not capable right now. So I'm just going to stay in bed and let Sophie love up on me. Someone asked on one of the YouTubes about the herpes. You can always go to my blog, divalivingwithaids.com, and type in herpes and kind of get some background of what's going on. I was infected, in a nutshell. I was infected with herpes prior to HIV, about a year prior to HIV. And herpes for me really wasn't an issue. I would have a herpes outbreak maybe once every 3-4 years. And then when I made a transition to AIDS and my immune system became compromised, I started to have more aggressive herpes, which most people with HIV do. We also have other herpes-related infections like CMV, which causes blindness. But the genital herpes is a separate infection that happened prior to HIV that has now been exacerbated because I have no immune system. We had it under control for, 15 years or so after I made a transition to AIDS. And then about 5 years ago, 5 years ago, I started to get this drug-resistant herpes. And when I mean drug resistance, I mean nothing I use helps it. Valtrex doesn't work. Acyclovir doesn't work. There are a couple of drops and creams that they use for other types of herpes, like herpes of the eyes and stuff. That doesn't work. And so I have to do the drug. I have to do a medicine, an antiviral medicine called false carnate. And it's the only thing that will make this herpes go away. And this herpes is really aggressive. I say it's on steroids. It's like someone has pulled layers and layers of skin off usually I just get one sore on my clit that becomes like this gigantic super sore. Occasionally I get infected in other areas of my vulva. The outbreak started a week ago. I should have been on medicine a week ago. So now we are 2 weeks in before I can start treatment. So I'm continuing to develop new infections. So my entire vulva is as if someone has pulled skin off my vulva, just took pliers and pulled skin off my vulva. And it is what it is. I have to get the port now because I've had, I don't know if you can see it really close, how bad my arm is. I've had so much scarring internally from PICC lines to treat the herpes that now I have to get a permanent catheter inside of my body so that I can administer the medicine when I have an outbreak. So this is my life. I ask that you would keep me in your prayers. Any kind of surgery, even though this was same-day surgery, any kind of surgery is whenever they have to cut on you, it creates trauma to the body. And so you can see there's a lot of bruising as well. And so I'm pretty kind of beat up right now. And I'm just going to love up on Sophie, Wolfie, my poodle, for you all who know, and have tea and just try to recover. I think we're going to start IV medication on Monday. In the meantime, I'm pretty much going untreated, so the herpes is becoming more aggressive and aggressive each day, which means I will probably be on IV a lot longer than I would, I'm hoping. Treatment can go from anywhere from 20 to 35 days. I just won't know. I have to stay on the medication until I'm totally healed, or it'll start to revert back. So just wanted to give you an update. The other thing I want to say is that there were a few people who bought bracelets over the weekend. Thank you. I had a trip on Monday. I thought that I would come home on Tuesday and ship orders out, but I was just so wiped out from that trip, speaking in Northern Kentucky. And so I'll try to pull them all together and have them in the mail to you by Monday at the very latest. Thank you for your support. I have no new bracelets on the website. I am almost finished with the fall-winter collection, trying to get it out. rltcollection.com if you've never been to my bracelet website. Trying to get them finished so I can get the pictures taken and get them on the website so that I can get some money coming into this joint, because it's hard out here for a pimp. No shit. I don't have any bracelet sales. I don't have any money coming in. And so it's been a little kind of tough on me lately. Anyway, that's the story of my life. I'm sticking to it. Please keep me in your prayers as I recover from this surgical procedure. And keep me in your prayers as I start this next round of IV medication. Let me say this. If I knew back then, if I knew in my 20s what I know now at 50, a lot of things would be different. I would have dated differently. I would have had sex differently. But I didn't know what I know back then about sex and relationships. And so at 50, I'm fighting for my life and my dignity and my ability to go on because of decisions I made in my 20s. I hope and pray that you are really listening, that you listen to my tweets, that you listen to my vlogs here on YouTube and my blogs on Diva Living with AIDS, and that you get some aha moments so that you can begin to make decisions about your life, so that you won't be where I'm at today, having to get a Metaport, a porta-calf, some people call them porta-calves, a porta-calf permanently placed inside my body to treat a sexually transmitted disease, one that I got prior to AIDS, but that has become exacerbated as a result of AIDS. It's become more aggressive and difficult to treat because I'm immunocompromised. Make smart choices so that you don't have to have the extra struggle at this journey in your life. I'm moving slow. I'm going to let you go. I'm rambling. Love you. Thank you for coming to my YouTube. Thank you for coming to my blog. Thank you for every prayer. Thank you for every bracelet sale. Don't forget my book, The Politics of Respectability, too. It's a good one. Support me. Continue to support me. Most of all, continue to pray for me. Love you, lovelies. Bye-bye.